exposure sorry, exposure, whether it's directly or indirectly experiencing or having experience with a traumatic event or life-threatening experience. We take a look at intrusive symptoms, and the person may experience dreams, flashbacks, or memories in regards to, like, specifically connected to the traumatic event. So all of these symptoms are connected to the trauma. Avoidance, so how behaviorally or even cognitively not wanting to think about those memories, talk about those memories, experience environments that might have some of the triggers that are related to those, related to the experience, the trauma that they had. They will also, another category of PTSD is the changes in moods and thoughts. So really kind of a detachment. You might see more of an isolation and disengagement from people, loved ones, friends, even things that they used to find enjoyable, kind of pulling back from. You might also see negative thoughts in relation to themselves or the reason why the traumatic experience happened, and arousal and reactivity. So that's where we might see more of that kind of constant alert here, like their heads on a swivel, always looking around. They might be more irritable and edgy, kind of. Some people who have been around those who have PTSD, they might actually feel like they're kind of walking on eggshells, because and that's where you might hear kind of some of that, because they're oftentimes just can be explosive and you don't see it coming. Reckless behavior, kind of self-destructive behavior, or just not really thinking all the way through. And then, of course, we see the sleep disturbances. And so that could be, they might be able to get to sleep, but perhaps they wake up in the middle of the night, they're having nightmares, they're unable to sleep for various reasons. Again, all of those things connecting to the traumatic event. So one of the things that I did want to kind of bring up here is that there is, and actually Dave and I were talking about this, I heard the idea of post-traumatic stress or post-traumatic stress symptoms, PTS or PTSS, versus PTSD. So PTSD is the DSM diagnosis, like we have to know that as therapists, as clinicians. So, but there is discussion on therapists and clinicians actually using more of PTS or PTSS. And the reason for that is that it focuses more on the symptoms and acknowledging that while according to the DSM, according to APA, it's a disorder, yes. But if we focus more on the symptoms and acknowledge to veterans that it is really a common experience to have these symptoms because of the trauma they went through, it takes away some of that stigma. So that's where you may hear more and more people who are working with veterans using PTS or PTSS when talking with this population and talking with their service member that they are working with as a client. So it just kind of helps destigmatize.
Yeah, and we really got to just also really quick highlight the other side of that coin, right? So kind of the general theme behind all this conversation is there's this stigma, right? So on the other side of the coin, that while there's more conversation today than ever on PTSD, and there's more efforts than ever, and there's lots of good things, and there's lots of visual indication, there's also things that are not being seen, right?
Mm-hmm.
From both the people with it and families with it who are ashamed of it in relation to the stigma of it. And so our idea today, really, because of this obvious and oblivious reality in our conversation today, is to go left to right and to explore the different pieces by which create the current lived realities of PTSD, and through our conversation together today, really try to uncover some key insights that really can inform our ability to move and integrate our conversations more together and to kind of progress ultimately to kind of help this healing happen. Okay? So, with that said, you guys can laugh at our little graphics, but this is just how we roll, right? As it says that we'd like to really just to kind of open the puzzle box of PTSD, and in the puzzle box, really take the opportunity to explore and discuss important pieces that culminate together, that create the picture on the box of what people and providers want to see happen that are concerned with mental health. Right? Is that a fair? Is everybody kind of able to anchor into that objective? All right. So to do that, we're really just going to start with this first kind of broad question, and we would love to kind of get your take on this as a group of, when you think about a family members. I'm sorry, I went too fast. When you think about a veteran's perspective on PTSD, what kind of things are coming to mind? Would you all have some thoughts about that? Oh, the hand raising thing. Oh man, Dr. V, you're gonna have to run this
Go
thing. I
ahead,
don't even.
Wendy.
Yeah, please. Holy cow. This is too high tech
I'm
for me.
sorry, I wasn't sure what the proper format
No,
would be.
that's
Yeah, I'm
perfect.
Mike. I'm
That's
Mike.
perfect.
Holy cow. Yeah, yeah. Good
Okay.
call.
I was thinking as a family member, who hadn't gone through the experience, family members might see it as they're exaggerating or it's not valid in some regard. I don't know. Am I on the
No,
wrong?
yeah. No,
Okay.
that's that's kind of like our like when we talk about the family members' experiences, if we kind of first talk about what the veteran may be experiencing or thinking or feeling, what kind of comes to mind for you? And it's really just like, what are your initial thoughts? Because that's what this is like trying to bridge initial thoughts and experiences and helping us all to come together.
Yeah, Jen shared in the chat this idea of being ashamed and alone. I mean, I can speak to that. If you all saw our presentation I gave at Cornell University literally 3 months ago about my PTSD suicidal path, that was very much the piece there. And Aaron topped in this idea of a loss of control. Aaron, would you mind, that's a very interesting comment. Would you mind maybe offering a little bit more from that perspective?
Sure. Can you hear me?
Yes,
Yeah.
ma'am.
Okay. Sorry, I'm using a new earpiece.
Yes.
Well, I've worked with the population before, and it's that loss of control. So they're used to being very in control and knowing what their orders are, what the next steps are, what the hierarchy is, and then now, whether it's in civilian life or just back, not being deployed, they have that sense of, I'm not sure what to do about this. I'm not sure who is, you know, what the order of things are. And I'm not sure who to go to about this. I'm not sure about, why I'm having these kind of feelings and thoughts. And it's just all that loss of control that they're so used to having.
Mm-hmm.
Yeah, very nice. Yeah, okay, got it.
Christy.
So for the experiences that I've had, one of the biggest was not being able to talk about what they were experiencing, for fear of disclosing something they ought not to,
Mm-hmm.
and also for fear of it affecting any future assignments. So there was a twofold fear for them.
Mm-hmm. Bob.
I just wanted to add to Aaron's piece. When you're working with veterans or service members who are now out, when you're working with them, it's also the loss of like your authority. Like you had your rank, you had your responsibilities, and when you're transitioning, often that piece, that loss of control, that loss of authority, can really be a big factor as well.
Mm-hmm. Kayla.
So what I think I've gotten from a lot of people is just this sense of weakness, how they went onto deployment, they're looked at to be the strength for their group, for their unit, for their country. And then when they get home, they feel like they can't handle everything that they had to go through. So they really have this sense of weakness in trying to reach out, which is, what kind of adds to their setback of reaching out, because they're looked at for so long for being strong for everybody, for the country, and then just really feeling weak when they feel like they need the help.
Mm-hmm. Yeah, Christy.
For my experiences with someone who was not deployed into a combat situation, but had lost brothers that were deployed into the combat situation, there was that they suffered in a different way and had that their PTSD was as a result of the guilt and the feelings that they should have been because they were trained up and they should have been over there and they should have had their six, and why they weren't over there, why they didn't get injured or killed in the same manner, and they were trained just as equally, but they didn't hit the deployment when they did. They are suffering in a same but different manner. So there's that as well, because they weren't necessarily deployed to an active, my words just left me, but to an active combat situation. So there's also that side of it that we sometimes forget. It's not always the PTSD that's coming from the active deployment, but from the feelings that they're getting of the responsibility that they didn't go to that active deployment, and they're getting the feelings of guilt and the things that they're seeing as a result of their brothers or sisters coming back, maybe disformed, disfigured, being now discharged from the services for injuries that they can no longer serve, and their feelings are coming from that.
Yeah, it's rich, and I'm trying to capture some notes too, right along the way, and I'll type these things up. Don't mind my scribble. Like, I've never been able to write with legibility in my entire life. Everybody's like, Dave, why'd you get a PhD? So I could write illegibly, right? Which is not true. But anyway, I'll type these up and send those to you guys if you want. But you're speaking to, I think Dr. V probably can also add to this, but to me, it's interesting the depth of the way something, maybe a similar thing on these deployments and these situations are perceived differently and yet the same, right? There's they're coming at it from different angles, and yet they're coming down to the same kind of injury. Dr. V, I cut you off. I apologize for that.
No. I'm just trying to watch time too. I think one of the things that we are focusing on, which is normal, right? When we think of trauma with military, we're thinking of combat and deployment. Military sexual trauma is another big one that is really important to be cognizant of and to be aware of, and how people may experience that and what that's like. The feeling isolated, these people who are supposed to have my back, supposed to be with me, are have done awful things to me. So there's another element that we just want to make sure that we're keeping in mind too, is that there's multiple different types of military trauma. All right,
Well,
in lieu of time.
Good segue.
Oh, I'm sorry,
Yeah, that's a good segue. No, I think it's a good segue, right? So the dimensionality here, right? If we just kind of shift to this other question now, is that, and we kind of went to there earlier on, but it's not just, it's not just the veteran, right? It's the veteran and their family, whether that's a spouse, whether that's a mom, whether that's somebody in their reach. And so how do you all, how have you seen and felt that, and whether from your experiences or just when you think about this, what do we have here?
I found that many spouses and family members have a sense of helplessness, like they don't know how to help because they don't understand. And then, if the service person doesn't want to talk about it, they also feel shut out. So there's that disconnect also.
Yeah, I while people are still kind of thinking through, I can speak to that too. My spouse, for even still this year, my last combat time was a few years ago, but right, she would have to, like, still even to this day, often like open a door, like wake me up, is to chuck something at me, like, and then close the door and leave. There was a time when And she didn't know how to do it. She's like, hey, I'm getting weapons pulled on me. I'm getting all these different things that are happening. And it's just part of the reality of it. And so then like, well, then how do you do it? And then often sometimes, who do you go ask about that? Hey, my husband pulls a gun on me every time I bump him. Like,
Mhm.
that's not something you go to like your friend's party and go, hey, I got like the joke of the day. That's not right. So she kind of felt stuck there to offer a point.
And I think, catapulting off that, there's isolation in that as well for the spouses, because and family members, especially after someone gets out of the military, they're no longer around the people who they have lived day in and day out with if they were active duty, and so it creates even more of an isolating experience of not being able to, not knowing who to go to, who to talk to about it, because there's also something that happens in terms of, well, other people just don't understand, and so therefore there's a disconnect there, in wanting to communicate, but then also like, well, they're just not going to get it, so why am
Yeah,
I think
absolutely.
there's also a component too of um someone who wants to help. So for example, I'm a licensed professional counselor, and as a spouse, there were things that I knew how to help or knew what to do in some of those moments because of my training. But then it was, I don't want you in that role. I don't want you to be my counselor. I don't want you to be my therapist. And so really kind of walking that fine line of, who am I? Like, what do you want? What is to be helpful for you?
I just
So
want to
it's,
jump in there real quick because it prodded a very thing I never even thought of, right? To think about the dimensions we always think of, I've always thought of it, even with my guys and my troops, their spouse. But think about this group here. Many of you all, I mean, I'm a student in this program, whether I'm going to be a counselor or not, but there's providers here, there's therapists in this conversation. There's I don't know how many people are actually even talking about that duality. That's an interesting thing. I never even thought of before. So thanks for pushing me there. That's interesting. Others? Thoughts there? Okay, if not, like I'm trying to watch chat too.
You brought up the fact of not being the therapist and the thing. So I have several military that are in my family that are very close members. So a lot of times I say, okay, do I need to put on the mom hat or do I need to put on the therapist hat? Which one do you need from me right now? And I make it very clear from the beginning, which role am I playing?
Yeah, and I just real quick on chat too, Christy and guys, I'm sorry if I'm messing up on chat trying to catch up with all this, modern technology stuff that I don't still understand. But Christy put an interesting point about, sometimes the disconnect is like, hey, you're done. That time's over, right? The sacrifices of, Christy, I'm not, by all means, correct me where I'm even trying to paraphrase what you said, which are great words. But it's like, hey, it's time to get over it. Like that's over. That's done. That's like that was yesteryear. That doesn't happen today. Now we're here, and and here's a nasty truth though. Are they fully wrong in that perspective? And I don't like. I'd be interested to think what your thoughts are. Like,
I think that a lot of times family wants to project their time frame onto someone coming back from the military because it's maybe their uncomfortability with what's happening versus what the person who's going through things needs. So, and I think a lot of that comes from a lack of understanding of their experiences and what they're currently experiencing. So, educating them on what PTSD is and what those symptoms are and understanding, what the needs of that particular person are, can be helpful in that versus, forcing, it's like grief, you can't tell somebody how long their grief is going to last. It's very individualistic. And so telling somebody how long or how short or how to handle their PTSD is kind of the same thing. You can't project that onto someone. But what you can do is be informed and learn to understand it and then deal with your own feelings as it relates to that. Because
Mhm.
there are times, yeah, I have all of this knowledge and this understanding, this education, but you know what? Sometimes I get pissed off when I'm
Mhm.
like, God damn it, don't you know you're supposed to do A, B, C, D, and E, and why are you not?
Mhm.
Because I am also human.
Mhm.
So there's that whole aspect that pushing my feelings or the family's feelings onto that person, that's where that push and pull comes from. So
Yeah.
Right.
Kayla.
It's kind of writing off of that actually, but really just the patience, which really takes a mental toll on, any spouse or family member. But really just the patience of the whole process. Cause like Christy said, you're never gonna know when it's gonna get even a little ounce better, right? So really the patience that you have to give them, and that could be a really long time. But that also comes with some sort of um, maybe guilt, and trying to push them harder than what's needed, or not giving them enough, or anything of that nature, but really just the push and pull of the patients. And when you lose your patience, we all have a reaction to how we lose our patience, and how that guilt is going to come into play also. So it's really just a big push and pull of patience, and when it's too much for you, and when you have to step back, and you also get that guilt of, am I stepping too far back, or am I losing all hope? It's a really big push and pull with patience, I want to say.
I think too,
I
if we're looking at, sorry, Dave, if we
No, go,
also
please.
look at how children may experience like a service member, there is a lot of expectations and education for them as well. And kind of speaking to some of my own experience as well as the work that I've done in this population, there's sometimes these kids are growing up a lot faster, and they are becoming aware of things that kids their age typically aren't aware of, and they are learning how to dance with the service member, with their father, with their mother. They're learning how to interact. They're learning when they should be stepping back. They're learning when leave them alone. So there's a lot that they experience, and then it also falls on the parents, and sometimes the service member or veteran isn't able to communicate that, doesn't want to, for shame, for guilt, a lot of different reasons. But so then that education part comes on the spouse's shoulders, and how they are able to then take care of or respond to their partner, respond to their kids, keep everybody as calm as possible. And so there's a lot of responsibility and a lot of weight that can fall on spouses or caregivers.
Well, I think that sets up kind of the elephant in the room for this audience, which is this kind of, all right, so who's got to, like, I won't say clean the mess up because that's not true because it's a collective thing, but
Mm-hmm.
how much pressure and weight sits on the therapist in this situation? What do you all think? Like, someone said that they had familiarity, some don't have much familiarity. So how, like, what's that look like for everybody?
Or how do you approach working with service members or veterans?
I approach
Yeah,
it from being straight and honest about it, telling them that this is a struggle, telling them that they're going to have bad times, telling them it might get worse before it gets better, trying to anticipate the things that might happen. So if they do happen, it doesn't feel so out of the norm. It doesn't feel like they're doing it wrong, kind of. I've heard that before. I'm doing this wrong, whether it's grief or PTS or whatever. I'm doing this wrong, and just right from the start, letting them know that they're not doing it wrong, that this is hard, that this is like a changing thing, that things might get better for a little bit, but don't be surprised if they regress. Just trying to be as upfront as possible about all the parts.
So I'm hearing transparency. I'm hearing normalizing. I'm seeing on the chat, creating that safe environment, that comfortable environment for them. Honesty, trust building.
I'd be curious. Is that? Oh yeah, sorry.
Go ahead.
Sorry, Dave.
Oh please, yeah. Please go.
Just simply focusing on the chief complaint. Where whether or not they have PTSD or PTS or things that you think are PTS or D. If that's not what's the most distressing thing to them at that time that you're working with them, then don't focus on that. Keep it in the background, sure. Maybe circle back or work on it later, but if there's a larger presenting problem, then that's the focus that you start with.
That's like that. It reminds me of that video with the nail in the head. Has anybody seen that? Like, I know there's the nail, but if that's not what they're coming to you for, then we could actually do more harm than, or we could just totally push them away.
I would real quick. I know we're in time, and maybe just for a quick response because I know we got to progress, but. How many of y'all, because it seems we have many experienced practitioners here, when you're seeing kind of the avoidance, what are some of the stuff that's like, how does therapists think about the military members when they're kind of wanting to talk around it? Like, you all need to help them get to address this PTSD issue that they're kind of deflecting from. How do you all think about that? Is that, it's more curious than being selfish, so I'm stepping in and then you all can kick me aside, but I'm curious what the conversation would be around, like, how can therapists think about when they see the kind of avoidance to the issue? Bob, building off of what Bob was kind of getting, I was just kind of the other side of it, man. Like, what do you do if that's actually what you see from your professional optic? What would you do for that? Any thoughts? It might be a bad question.
Go ahead, Christy.
For me, a lot of times, like I said, in my area, it's like a spread out town with a real small town mentality. So a lot of times it's building trust. It's knowing the lingo with them. And then they kind of talk to one another of, yeah, you can talk to so-and-so, you can trust them. She'll have your six, meaning she'll have your back. So as long as you get that little bit of an in, they will still dance around issues. And a lot of time with them, that sarcasm and humor is really big with them. And then devil's advocate comes into play a lot, or kind of a little bit of the mic drop, or my favorite one. So yeah, so how's that working out for you? A lot of times, and it's done in a lot of very conversational type therapy with them. It's not they kind of have this image of therapy is very stuffy and very rigid, and with me it's very conversational and very laid back, which brings down their defenses. So when they're dancing around something and they're coming back and saying they're always having the same problem, but it's not really a big deal, and I'm like, well, maybe it is because you keep bringing it up. I mean, I don't know, you're the expert. And they're like, and I'm like, yeah, so how's that working out for you this week? Those types of things tend to work for me, but not always, because they're each individuals. And sometimes they're like, you know what, I just don't want to talk about it, or I just don't want to deal with it. And I'm like, okay, well, when you're ready, you know where to find me. I'm here.
Now the Pandora box is open. Here we go. All right. It's good. Is that the right word? I don't know. Kayla?
So I think, as counselors as a whole, you have to pay attention to like every mannerism possible, right? You're really trying to read into things, but not too much. But I think you're really going to tell what's important to them by their mannerisms, by their face, their affect, their fidgeting, right? So really paying attention to stuff. Also, like Christy said, they're going to keep bringing it up if it's, even if it's like so nonchalantly that it's not a big deal, quote unquote, right? But if it's really bothering, they're going to keep bringing it up. And I think veterans are used to like just hearing things straightforward, you know, it's like your call of action kind of thing over. But I feel like a more direct approach and like, hey, you know, you keep bringing this up. Is it actually not a big deal? Because that's, you know, that's what it plays into. But also just like really pointing out their mannerisms, because I think being in the military, you're kind of taught to stay and like act one certain way or another, like very rigid. But you can always tell from facial expressions, whether they think they're putting them out or not. It's really hard to hide your facial expression when it comes to something that is really bothering you. So really just paying attention to those little things that you can bring up later, because they're going to think you didn't see it, but you know, you do.
Hey, we
All
have
right, we're
time
gonna
for
take
just
one more.
Yeah,
Yeah.
one more. Yeah, good to see. We're on a Sawyer there. Go, Nikki. Uh-oh.
Yeah, I would
Yeah.
say I do a lot of work with substance use too. And sometimes I just bring up the concept of like using substances, or I give a list of avoidant behaviors and I can say, hey, which ones are you doing? Which ones do you notice changes in? Or which ones would your family or friends notice changes in relative to where you might be avoiding things? And just like broach it right there.
Got it. I think that's what all these points are super, and I'm trying to capture notes too, and we'll go through. It really sets us up if we back up. I think this is a great segue now to back up and say it's one thing to talk about these pieces in isolation, but we can all appreciate that not one piece is going to solve this problem. PTSD is not just a veteran's problem, right? PTSD is not just a therapist's problem or a family member's problem. In fact, we got to connect these puzzle pieces together, and so. Maybe we could just take a few minutes just to back out a little bit and start to think about what are methods and ways and insights of connecting these things together. Thoughts there? Go back to someone's point earlier about just get over it and connect and go forward. I don't know. That was probably not the. I mean, like guys like me are all into that, but like that's probably not the. This might not be the path.
Yeah, how do we think that we could bridge the gaps here to help, you know, each of these people be able to work towards the goal? Bob?
One thing that's very useful is many service members are helpers at their core. Like that's kind of why they joined. And so like finding and hitting that button of like, you know, getting them to continue to serve or to help others. And the way that, you know, you can kind of shine the spotlight on like, you need to help your family. So that piece has proven useful for me.
Others? I can share one real quick while people are thinking is that, you know, part of it is what you all have thematically been talking about, which is really trying to, one, identify that often every one of us are going to come up, we're going to show up from different pages of the book, right? The therapist is going to show up from a certain perspective, the family member the perspective, and the veteran the perspective. And so just acknowledging that point on the onset, I think allows these groups to back up and to start to be able to see like the way we kind of talk to guys, you know, I'm a former pararescue guy, right? So like we shoot a lot, and just the optic of shooting or the optic of sight, when we hone in on one piece, we're going to zoom into that. But when we back up, we can start to see more of the picture, which then maybe we can see each other. Once we can see each other, we can talk to each other. But when we can't see each other, how do we even talk together? Right. So I think that's one thing that's often what I would tell you, or what my experience being a patient in this process is that often a traditional experience I had and my guys have had, so much so that we kind of stopped going and seeing the therapists and the doctors because we're like, whatever, is they walk in and they pull out their book and their clipboard and they go, we're going to go to, you know, step 14 of the protocol. And then we're going to, and here's your meds. Here's the thing we're going to check off, and we don't care. Like, and I'm not saying I'm just saying like that's, I don't know if even the doctors or the therapists were even showing up with the malintent there. It's just, that was from a perspective, right? So maybe the other part of this too is recognizing that it's maybe not malintent, it's just an inability to see, if that's an offering point.
Kayla?
I really like that perspective because I hear a lot, I feel, and that's not even with just military in general, but a lot of people are just like they want something more than just meds and nobody
Mhm.
seems to care, or there's just a
Mhm.
lack of knowledge. So I really think more education and more advocacy for veterans and PTSD and PTSS um, is really needed in the communities more. You know, you hear veterans and you hear PTSD, but nobody really knows what that is to a sense, or the core of it, or what families go through along with, you know, the veterans. So I think a huge thing in most areas of mental health is just the education piece and really hammering it in and really pointing out the more important aspects as opposed to just, you know, throwing in, you know, medicine and anything else that could like subside it. But really just getting that advocacy and education piece out there more.
Yeah, I agree. Dr. Villa, any?
Well, I think that's a perfect segue actually
Yeah,
into,
that's,
I'm just taking a look at, like, we've got just a couple minutes left. So
yeah,
if we look at, you know, some of the things to bridge these together, to create our heart, to heal PTS for everyone who is involved, because as Dave was saying, it's not just one person, it's not just one family, and I mean, there's a significant impact to it. So if we scroll down, Taylor, you were talking about education. What a big piece. I've heard this as a theme as we were talking today, was how important it is to educate. And so education comes on all levels, right? So it's not only that um, we are educating, you know, one component or one piece of this puzzle, but it's a willingness for therapists to educate themselves on the population, on working with, you know, working with this population, getting to know people who are in this population. It's helping to educate the family members, the spouses, the kids, on, you know, maybe things to expect or ways to help, how to cope themselves, how to take care of themselves in you know, within this uh, you know, component of what they are experiencing. And then also educating the service member or the veteran on different elements of what PTS is, what that might look like, ways to, again, manage, cope, and then, you know, ways to be able to to keep walking forward, and to find a new sense of identity and purpose and meaning, and what their life is going to look like, can look like, and kind of moving on. I think one of the things too is that vulnerability piece, right? So, you know, helping the therapist to be vulnerable, having, like, for us as clinicians to be humble, and to really approach working with this population from a sense of humility. And also, like, if we look at the spouse or the children, helping them to also have a sense of vulnerability in having courageous conversations, being willing to talk about things that might be scary or fearful or anxiety provoking, and really just a piece of, you know, for the service member or veteran themselves, of being vulnerable, of opening up, whether they're opening up to a family member, or they're opening up to a friend, or they're opening up to a therapist. But there's an element of all three of those pieces needing to be vulnerable, and needing to you know, just kind of release some of the barriers that we hold tight, that we all of those pieces hold tight to us. And then with the conversation, really just helping all three of those pieces to have those courageous conversations. helping the service member or veteran be willing to have those conversations. Sometimes that looks different. Sometimes it may be that we are approaching it because, as Bob said, they're coming into us for something different. Great, that's our door. So rather than focusing on the trauma, let's focus on careers, for example. That, to be honest, that is exactly how my spouse was able to receive support initially. He was going for career support, like career counseling, and so that was the door, and so that was the focus for a long time until there was safety and comfort and an ability to move into that next level. And for family members, for the kids, for moms, dads, like just the conversation and willing to put themselves out and share, this is how I'm feeling, this is my experience, can you share with me what your experiences are? And then, again, all that vulnerability kind of comes into play.
I think in this backdrop, just out of interest for our conversation, we'd like to talk to you guys, just to have a few minutes of opening reflection here, and what's, even questions that you may have for, Dr. V and I cover some interesting perspective if you look at across our lives, professionally and even academically. Like, we're both PhDs. I'm not a PhD in your world, but I'm a PhD on the other side of of a perspective. And I would just be curious to open up, like, for some of you all, what would you want us to, what's some of the reflections you have, or even questions you may have for us that you want us to answer?
Or even just food for thought, like things for us to, things to just keep in mind as we kind of conclude here. Kayla?
The hand thing. I gotta figure out this fancy hand thing.
I guess I'm wondering how, because I'm still like in the graduating phase, but I'm wondering how or who I can go to just kind of advocate for more awareness in like the community. I know, Dr. V, I took one of your veteran classes and we had to make like a brochure of things of areas around that would help veterans, which was like super helpful in one conversation, because I was like, somebody was like, I don't know where to go about with this. And I was like, oh, I made like a brochure in one of my classes. Like, I'm going to look this up and like send it to you. And they love that. But I guess just like who would you suggest, like even like at a local, of who to go to try to advocate more for like sources and education to put around the community?
So I think I'm thinking of my own community, but I mean, for some places there are vet centers. So that could be a resource for you to springboard off of. Not all people want to go to vet centers, I'll just be very honest. But it could be just that door for you to kind of get some ideas, and then take some ideas, create, and get together with other people who are interested in working with this population or advocating for this population, and then coming together and kind of creating a group of you that can spearhead new ideas and new ways of supporting people. And unfortunately, in rural areas, there really isn't a whole lot. And so it does take people to come together and spearhead new ideas, new initiatives.
I'm curious, and this might be too much of a question for the end of the session, but what your thoughts are. I have a client who wants to get PTSD treatment through ketamine, and I was just wondering what y'all's ideas were on that kind of treatment for PTSD.
I mean, I can give you from a non-medical licensed professional perspective that my own PTSD research is that, and with my guys, special forces guys, the ketamine's a deflection. It's literally the expression of the deflection, that it's the answer because there's no other answers. It's the scream. I've got guys right now. You guys know that the legislation for approving some of the MDMA stuff didn't get fully funded, and there's guys uproaring because that was their easy answer because they're so desperate. And so there's this, I don't know, very interesting special interest group around what they want to serve. But I'll just tell you that my guys, I've lost 5 of my soldiers this year to suicide. I am now at 11 total of my guys over the past handful of years. And what I will tell you, the ones that talked drugs, it was because it was their last, they've given up on everything else and they were just asking for someone to jump in with them and no one would. But that's only from that perspective, not a trained medical health pro that Dr. V can probably give more of an eloquent, appropriate answer to.
May I, Dr. V, Dr.
Yeah, go
Silverman,
ahead.
Dr. Moyer, may I jump in on that ever so
Sure.
quickly? So we have Dr. Blaine Riley and myself have a presentation at 12 speaking on psychedelics in counseling. So we are going to touch on the use of ketamine-assisted therapy. In fact, Dr. Riley is going to talk from firsthand experience on it. Now, Dr. Silverman, you are correct. The FDA did make some decisions, but they didn't block it completely. They just need more evidence
absolutely.
in their research.
Yeah.
And a lot of the problem, it is seen often as a last-ditch effort for some of our patients, but a lot of the problem is a cost availability, number one. That has an issue with it, and again, it's not a panacea. Like, no one's going to go and take ketamine and be fixed. The biggest issue, more so than taking the medicine and its effectiveness, is the integration afterwards, and that's the big. I think that's one of the things that we are still struggling with from a psychedelic assisted therapy standpoint. So there's definitely benefits there. It's just the system is not set up as of yet. We're getting there, but set up for the best possible outcomes. And I'm always happy to chat. I was on with the FDA for 2.5 hours last Friday. It was a very long conversation.
Hours of your life you're never going to get back. Yeah, it's one of those.
Correct. Correct.
Yeah.
But it was enlightening because it was an hour of the FDA giving their side of the story, and then they had 2.5 hours for rebuttals, and there were several physicians and psychiatrists and many veterans who were in tears because it was kind of they were